course, a lot of scholars to that. Now, the evolution of mankind, how we have come up from our ancestors to these human beings. Health, again, a very, very integral part of it, and we have evolved about it. But at the same time, there are risks which has evolved along with the development also. And this is, we are back to how we have started. We started becoming erect, and when the time came, we turned back on the other side. So this is what the era is. Now today's world, what are we seeing? I mean, these scenarios are not uncommon. You must have seen this. Earlier it's a sign of prosperity. Another thing is what we are seeing is the childhood obesity, which is now coming, and which is also not uncommon. India is changing. People are ready to spend quality of life come first. If you talk to your birthday,
that's not clear, right?
India is changing. People are ready to spend quality of life come first. Yeah, so I don't think because it's not matching this LCD. It's not matching.
Nice picture.
Thank you. So today you will have, if you have to speak to your Maharaj or Joshi, even he is carrying mobile. Yeah. Can you imagine that 10 years back that your Pandit or Maharaj would be carrying this? And what's going to happen to Mumbai in 2020 years? Of course, Ram and Ara Patil has planned that Mumbai will be the next Shanghai. We really don't know, but this is the anticipated Mumbai in 2020, and probably the health library will be at the top of this, right? So we will have all of you sitting in a AC hall in the health library. I'm sure Dr. Marpani is working on it. Now, there are certain known modifiers for risk factors. That means you can't do anything. Age, when you stop your age to increase, nothing, you can't do it. Gender, you can't change. Even if you do a sex change operation, the risk doesn't change. So gender, you can't do. Family issue, you can't do, as I mentioned. So that is, but there are certain modifiable risk factors which can definitely help. And these are controllable and treatable. Controllable means you can have a total control of this, like the smoking, alcohol, weight. You can have a control. Treatable means they are not curable. Treatable means they need to be corrected. Like diabetes, whatever you do, you can't go, right? So but you need to keep your sugars under control. If you have hypertension, you need to keep your BP under control. And a high cholesterol, you need to keep your cholesterol under control. Smoking. Now, as it is prevalent, increasing day in and day out. Now, why does we talk so much on smoking? The nicotine accumulates in the blood vessels. It is directly causing impingement in the coronary circulation. It doubles your risk of heart attack. If you take two persons with all the factors risk, one is with smoking, one is without smoking, and just see what happens. The percentage of getting heart attack is double the person who just has smoking compared to his. It reduces oxygen in the blood, it damages the blood vessel walls, it contributes to high blood pressure, so it has one direct effect on the heart vessel, as well as it also increases blood pressure, which also tends to increase your risk of heart attack. It contributes to low level of HDL cholesterol. HDL cholesterol, which is supposed to be a good cholesterol, which is a protective cholesterol, so it reduces even HDL cholesterol. So this is how smoking is going to give effect. So say no to smoking. That's very, very important. Alcohol. Now people say no. Is it beneficial to the heart? Yes, it is. But then, how? It increases HDL cholesterol. That's a good cholesterol. Wine is fine of all the varieties, of course. But it doesn't mean that those who are not drinking, you ask them, okay, now you start drinking because you will have a risk of heart problem. But at least those who are consuming, of which wine is fine, and just one drink a day, that is fine. Moderation is required, which is very, very difficult. For the people who drink, they are not going to drink wine, they are going to drink something else. Second is, it never stops at one drink, it is second, third, and fourth. And third, it never goes alone, there are some companion with it, like peanuts and cashew nuts and all, fried chicken, and that all accompaniments which comes, and that is, so it's not the alcohol which is bad. So you have to take the right sense. Of course, it interferes with insulin action, so persons who are diabetic should be careful. It can cause hypoglycemia. Of course, the cardiologist always says that if you are taking alcohol, one drink in moderation without any other problems, you will not die of cardiac problem. You may die of liver problem, but you will not die of cardiac problem. Now weight, excess body weight increases your risk for everything. Think of high blood pressure, high cholesterol, high triglyceride, diabetes, heart disease. There's so many factors. It's going to increase your risk. Now, see the progress, how it has happened from evolution-wise. We had anticipated the generation should be like this. It gradually started coming like this, and then now you see so often. Sometimes you really start thinking, is he pregnant? Then you say, no, he's a male, so he can't be pregnant. But that is what is happening. You literally start sometimes even they find difficult to sit on the back seat if the front seat in the car is taken totally that works. This is what the ground reality is. Now, how do you see it? What calculate or check for obesity? Obesity is measured on the like BMI. You have heard of this body mass index, which is nothing but weight in kilogram divided by height in meters square. Normal is, this is very important, 18.5 to 23. And overweight, that means if you are 23 to 27, and obese more than 27. So now today, you start calculating what is your BMI and you fit into what criteria, whether you are normal, whether you are overweight, or whether you are obese. There is another definition in terms of waist circumference. For females, anything above 80 centimeter, and for males, anything above 90 centimeter. Just check what's your waist size or what's trouser size you are using. If it is more than 90 centimeter, you are having obesity. So that is, you need to check out. Now, which type of obesity is dangerous? There are two types of obesity. One is called as apple shaped and pear shaped. Apple shaped, that is a central obesity, which is, the old time concept of prosperity, and that is that. Females usually have a normal, this pear-shaped obesity, which is a normal. Now, so this is the at-risk patient I am talking about. He has got all the possible factors which can contribute to get a future. You can see him next time in the ICU. Now, so I am not talking of the patient who looks like this, but when they don't take care, they will look like this, and that feels like that. Now, obesity, why do we need to control it? But because, as I mentioned, there are so many root causes, causes which start from this. And you have to understand why this happens. It is in our lifestyle. It is eating habits. When we go out, what do we eat? These are the things which we usually prefer. And these are the things which usually should be avoided. These are the same things we eat outside. I'm sure you have one of the lunch or dinner outside in last 3-4 days. What did you have? I'm sure you're not going out for chapati sabji dal, right? You are going to have one of this stuff. So above all, our lifestyle has happened what? Earlier you used to get nice bag. Now you get a Maharaja bag. It's a double size. Then earlier you used to get a vada pav. Now you get jumbo vada pav. So everything has gone down. Earlier you used to get pizza. Now you get double cheese pizza. You ask, "Jara double spread karna." They give an option. What do you want? If you want extra cheese or anything. Yes. And that is what we try to opt for. So it is, we should not upsize, we need to minimize, not to maximize, but this is what happens. Now, sedentary lifestyle, again, we have got a transportation facilities, everybody has a car from home to directly to the office, sitting in the car, sitting on a desktop. Now, again, everybody has got their own PC, sitting in a comfortable AC environment, in the office or at home. Consuming alcohol, only alcohol is not there, then there is a accompaniment which I was mentioning, of course with smoking. And all these are nothing but we are putting the roots for our giving invitation for a cardiac event to come. What happens to childhood, which I was talking with? Now this period box has really spoiled the culture. Our children, what are they doing? Either in front of television or in terms of a PC. That is the root cause. क्योंकि टीवी से ही obesity होती है या तो laptop. So that is what all this leads to. This was the survey carried out on the Bombay Police Department, and you know what is it? He is just and probably you may be identifying these people. He is a senior PI. He is a ACP, and he is a DCP. Now see what happens. The level goes up, then wealth level starts coming down. And this is the reality. Yeah, this is from